Hello, class. It's been a while since I've had the opportunity to see you, and those of you who are older students or those of you who are new students, I want to talk to you about Module 3. In this mod, what we're going to actually do is learn delineations that are for clinical aspects of medical assisting. Today, I want to start off with teaching you parenteral routes, and that's PARENTRALROUTES. A parenteral route is a route that we use when giving medication through a needle. A lot of you have completed your phlebotomy mod, so you're very familiar with needles. In this module, this type would be the needle and the syringe method to deliver medication directly to a patient. Each route has a different efficacy. When it comes to a needle, you are aware that the needle has a shaft and the needle has an opening. That opening is known as the gauge. The gauge is the hole in the needle. The hole in the needle or the gauge is very important when it comes to delivering parenteral route medication. Parenteral route medications and why it's important is due to the viscosity of the drug. What that means is how thick the drug or medication that you are delivering to your patient is. If the medication that you're delivering to your patient is relatively thick, you would want to utilize a bigger gauge. When you are pulling your needles, you're going to notice, and let me see if I can get this close to my camera. Okay, you're going to notice that you'll see a number with a G behind it. That number is the gauge size of the needle. Right behind that number, you will notice that there is, I'll turn it, is a fraction. I'm sorry, guys. It's going to look different on your side, but this is, excuse me, let me turn it over. This is a 27 gauge. Let me see if I can do that again. This is a 27 gauge, and the needle size is a 1/2 inch. The 1/2 inch or fraction is the length of the needle. This is a package, and you'll notice again that they're on the package. And let me see if I can bring that forward or backwards some. There. You'll notice that on the package, and I think I have it. You probably can't see that. Let's bring it back a little bit. You'll notice that on the package it says 25 gauge and a 5/8 needle. Again, the 25 speaks to the size of the hole in the needle. The fraction 5/8 is the length of the needle. Why is the gauge important? Just as if with phlebotomy, the bigger the number, I showed you a 27 and a 25 gauge. The larger the number, the smaller the hole is in the needle. The needle that I'm holding came out of the package with the 25 gauge. The needle in this box is a 27 gauge needle, okay? So this would mean that this 27 gauge has a smaller hole than this 25 gauge needle. When it comes to gauges, again, the importance is going to be the medication you are delivering. If you're delivering a medication that is thinner, you would not need a larger opening in the needle. If you're delivering a medication that is relatively thick, like vitamin B12, you would want to pay attention to the gauge size. Again, the gauge is in relationship to the viscosity of the medication that you're going to deliver. The smaller the number, the bigger the opening of the needle or the gauge. The larger the number, the smaller the opening of the needle or the gauge. So I have a 25 gauge needle, okay? You'll notice that my needle has a safety. My needle has a point. That point, and let me see if I can back that up. You probably can't see that as proficient as I would want you to, but that point is known as the bevel. The bevel, the best way I can describe it, is the consistency, well, I don't know if that would be the right word, but it has the sharpness of a needle. You want your bevel to be sharp. Think of eating a steak. If I had a steak in front of me, would I want to use a butter knife or a steak knife? Well, the steak knife would be sufficient because it is meant to cut steak. When you pick up your needle, the bevel is meant to pierce through the flesh. So it needs to be sharp, not blunt or broken. Blunt, broken, or unsharp bevels cause additional injury and harm to our patient. So a quick inspection of your needle is going to be very important prior to delivering your medication or drawing up your drug. Let's talk about preparation for administration of a drug. We are going to get into what we call the 6 rights of medication administration. And I'll be sending you a handout so that you can readily identify what I am actually talking about in today's lecture. So, when it comes to preparing your drug for your parenteral route, in this course, you're going to learn several different routes. Today, I am going to utilize Mr. Arm, and we're going to do 2 of those parenteral routes. One is called subcutaneous, and the other one is intramuscular. So an intramuscular route and a subcutaneous route would be what I am showing you today. So back to the execution of administrating a drug. The very first thing that we want to keep in mind is we want to make sure that we have the right patient in front of us when administering a drug. The same thing is important when it comes to gaining consent. We check to make sure that we have the patient that we're supposed to draw on in front of us. This is the same type of consent or the same thing that we need to do when it comes to checking our patient. The right patient, we would go into our room, introducing ourselves as we already know, giving our name, our title, and why we're there. That looks something like this. Hi, my name is Natasha. I'm going to be your medical assistant today, and I will be performing your labs. Well, in this case, hi, my name is Natasha. I'm going to be your medical assistant today, and the doctor has ordered a sodium chloride injection. You'll notice that I didn't say I will be giving you a shot, okay? I tried to veer away from the word shot because shot sounds so negative. We want to use the proper medical term, which is an injection. So we will be delivering an injection. So now that we have introduced ourselves, we want to gain our identifiers or making sure that we have the right patient in front of us. So how we're going to do that is we're going to ask our patient their name. We're not going to walk in the room and tell the patient their name. We're not going to say, and Dr. Beards is in the room with me, so I'm not going to say, hi, are you Dr. Beards? No, that would be incorrect. I would want to walk in the room after my introduction and say, can you please provide for me your first name and your last name? In a real world scenario, we would want the patient to spell first and last. As you know, I am a person who only asks my patient to spell their last name. But when we want to ensure that we have the right patient, it would be correct to ask them to spell their first name and their last name. The rationale behind that is because what if we have a Susie Smith spelled S-U-Z-Y, okay? All right, and she spells it S-U-Z-I-E, and we have a Smith as a S-Y-M-T-H, and we have it S-I-M-T-H. That would mean we do have a Susie Smith in front of us, but do we have the right Susie Smith? And according to this patient verification for appropriate patient identity, we do not. So we would ask, hello, can you please provide me your first and your last name? Dr. Beards, could you please provide me your first and your last name?
Yes, my name is Misty Beards, and that is B-E-A-R-D-S.
Good. So what I have done is I validated what Dr. Misty Beards has told me against my MAR. My MAR could be my medication record, or my patient's record. All right, I would make sure that my patient's chart has the correct name and that the order is for Dr. Misty Beards. After I have verified that I have the right patient in front of me, I want to now verify my drug. Okay, never use a drug with a handwritten label. I'll pull this back some. As you can see, my drug is written on the label. It is not handwritten. It is manufactured written. All right. I want to make sure that I have the right drug. And what that means is, does the drug that I have match the order for what I'm supposed to deliver? I would check my medication, my drug, 3 times. 3 times. The first time I check it is once the doctor gives me the order and I remove the medication from the medication closet. I would make sure the doctor's ordered 9% sodium chloride. So as I pull that drug, I'm checking 9% sodium chloride. The next thing you want to do is pay attention to the lot number and the expiration date. As we go through this lecture today, you will understand why the lot numbers and expiration dates are very important when it comes to us doing our job. But right now, I'm checking to make sure that I can deliver this drug and it has not expired. So now I'm going to draw up my drug. This is at the point that I am going to check it my next time. So I pulled it, check 1. I'm drawing it, check 2. So in order for me to draw my medication, whether you're drawing it at a drawing station, in your lab, or in the room with your patient, you want to make sure that you have everything that you need so that you can execute this skill and deliver and administer this medication. So I have the correct needle that I'm using. I told you earlier that this needle is a 5/8. A 5/8 needle is the needle size that I need to execute a subcutaneous injection. You will get a cheat sheet from me with all of your needle sizes. You will also get information from me in order for you to understand each route and each needle and size and gauge that correlates with that route. So I have my needle, I have my medication, I have my alcohol pads. I also would have in front of me my gloves. I would have washed my hands. Okay, so I'm going to put on my gloves. Ideally, you want to make sure that anything that you do, that you have on the appropriate PPEs prior to doing it. So you see me with my gloves, I'm going to don on my gloves. So I have my gloves, one is on. Donning on the second pair. Don just means putting, okay. All right. And I have my medication vial. Ladies, this medication valve is a multi-dose valve. Out in the real world, you'll have multi-dose valves, which means many doses can be actually administered from one valve. Or you'll have a single dose valve, which means after you draw up, that valve is no longer has any medication, so you would go ahead and discard that medication valve. Now, because this is a multi-dose or whether it was a single, I want to clean the outside of my stopper. Okay, keep in mind, the inside of this valve is sterile, but everything on the outside of this valve is non-sterile. When delivering a parental route, we want to practice medical asepsis. Medical asepsis is where we eliminate pathogenic microorganisms. These are organisms that have the ability to cause a disease, a pathogen. So the way that we can proficiently eliminate that is to use an antiseptic. In this case, I'm using 70% isopropyl alcohol. 70% is a high enough percentage to eradicate, eliminate, or inhibit the growth of microbials. Okay? All right. So what I'm going to do now is take my alcohol pad and wipe the outside of the valve at the point that the needle would be inserted. Okay, once I wipe the outside of my valve, the only thing that should touch this valve at the top is my sterile needle. Okay, I have my needle for the correct route that I'm using. So I want to make sure that I make sure my needle is fully secured in my hilt into the luer lock of the syringe. One of the things that I also would do is I'll pull back on the plunger. What that does is called breathing the syringe. Pulling back breaks the seal, making it easy for me to actually pull the medication into my syringe. I am now going to take off my needle. Once the needle has been removed, the cap has been removed, the sterility is now compromised. So but it's sterile, take the sterile needle, insert it inside of the rubber stopper. Okay, I am now going to draw up to the right dose, which is the third medication, rights to the medication administration. Right patient, right drug, right dose. Now I'm on the third. Right patient, right drug, right dose. You heard me say that I have 9% sodium chloride. The 9% is not the dose. It is the percent of sodium chloride per ml. Now, also keep in mind, when the doctor gives an order, he gives a dosage order. So in this case, we are going to say that the order is 0.5. I'm going to go to my board now. I don't know if they can see that, so I might have to get Dr. Beards. So my dose, you might got to change it to you, is 0.5. You can still change it around. Okay.
I'm gonna do that.
Let's see. You might gotta hold it. Can you see? Yeah. Let me see. Yeah, you can bring it. So my dose is 0.5. Also can be referenced as a half ml or cc. On your syringe, you will notice that we have something that looks like this. Little lines. Okay. All right. Depending on the size of the syringe, all right, So here I have 2, 1, okay. No. Here I have 3, 2, and 1. All right? And this is, the decimal is behind the number. So this would be regarded as a 3 cc syringe, okay? So on this 3 cc syringe, and my dosage is 0.5, it would be half of this 1. This is my 1 point. So I need it to be half. So here, right here, you would notice that that is my 0.5. All right, right in here. So this is my 1. Let me change the color, so I don't want anybody to be confused. Well, my 0.5 would be in here. Okay, this is my 1. 1. Go on with this, and here is my 0.5, or my half. Sometimes the half and the 0.5 will actually be, the half will actually be imprinted on the syringe, making it easy for you to identify that dosage. But then there are times when you do not have it there, and you'll have a 1 point, a 2 point, and a 3 point. And you would have to know that my half cc is half of my 0.1. All right? So now we're going to get ready to draw up our drug. Thank you so much. All right. Dr. Beards, what's my... Hold, I think that light right there makes it so difficult. I wonder if I come this way. Okay, so, y'all, we having a little bit of technical difficulties. All right, so here, my needle, I am now going to draw. I tend to draw past my actual dosage and take it back up, and this syringe actually has a 0.5 marked on the syringe. What I want you to see is that my solution or medication is all the way to the dosage, and the medication is also inside of my lure, or the color part of my needle. There should be no spaces. When I turn this horizontally, that's horizontal, then I don't want to have any spaces between the medication and the inside of the syringe. This would mean that I am at the correct dosage, and this is what I'm looking for. Now, I am now ready to deliver my drug. One of the things I want to let you know is that it would be very, very important for you to switch off the needle that you drew with and utilize a different needle, same size, to deliver your medication. Why? Because once we opened the needle and we drew the needle, the medication from our vial into our syringe, our needle became exposed to the pathogens in the air. Once they attach themselves to the needle, the sterility of the needle has been compromised. I am going to be delivering this to Mr. Arm. So, for the sake of making sure you're doing this correctly, before I even give Mr. Arm my subcutaneous injection, I am going to close my needle and snap the safety, because it's at this point that I am going to use another 5/8 needle that has never been opened, and I'm going to use this needle to deliver to my patient. So I'm just going to open up, since I don't have a 5/8 needle without a syringe, I'm going to open up another syringe that has a 5/8 needle, and I'm going to simply twist that needle off. I did not remove the cap. I did not remove or engage the safety. I am now going to remove the needle I just drew with. I am going to put this needle in a sharps container to avoid anyone receiving a percutaneous dirty needle stick. I am now going to place my new, fresh, unused needle that has not been exposed to any elements on to my syringe that I have previously drawn. Okay, so what we've done, we verified that for one, we have the right patient, we have the right drug, we checked the expiration date, and now we have the right dose. We've looked at the medication record, we verified the dose with what the doctor has actually written within the soap note, and now we are ready to go into the room and deliver. We want to now look at the route. This is the fourth. Right patient, right drug, right dose, right route. Today's route is called a subcutaneous injection. Subcutaneous injections are injections that are meant for slower absorption. They are going to absorb within your patient's system a lot slower than other routes. The efficacy of the drug, meaning how fast or how slow the patient is going to feel the medication administered, is going to be based on the route that the drug was administered. So we're doing a subcutaneous injection. These injections are meant to go into our fatty back of our arm, our abdomen, or our thigh. We are going to give Mr. Arm in the back of his arm, okay? The back of his arm, we're going to give him his subcutaneous injection. Keep in mind, his subcutaneous injection has to go in at a certain angle. The angle for a subcutaneous injection is a 45-degree angle. We must administer this at a 45-degree angle. It is where we're going right up into our patient. We're going to go up into the patient at a 45-degree angle. Before we do that, we want to make sure that we cleanse the area utilizing concentric circles. That is where we think of a cinnamon roll, starting small and then widening our spirals so we can encompass about 4 to 6 inches in diameter. Remember not to go within that area again so that we can fully practice medical asepsis. So I'm going to have Dr. Beards come hold Mr. Arm, and I am going to deliver the sub-Q injection. So we'll try to get where we're by the camera. Okay, Dr. Beards. The back of the arm, this is where we're giving it. Okay, all right, we have our needle. Okay, I told you 45-degree angle. So here, I'm gonna grab my patient right here. So I've grabbed, this is the back of the arm, I've grabbed the patient. I prefer not to do this because I want my hand to be distal from the area. So I'm going to grab my patient here, okay? And then I'm going to administer at a 45-degree angle up into the fat. Remember, this is for fat. This goes into the fat. Again, the areas are the back of the arm, this fatty area, your abdomen, or your thigh is where we deliver sub-Q. I am now going to wipe my patient's area in concentric circles. I am now going to make sure that my bevel, which I told you is the point of the needle, is facing up and that I can visualize my gauge and it's up. I'm going to grab my patient's back of the arm, go into it. Remember, the hand that houses the needle should never switch or be moved. This hand stays stable and it always houses the needle. Never switch hands after delivery, okay? Keep in mind the hand that you're going to use should always stay with the needle. The hand that moves is the hand that I'm using to pull up on my patient's fatty area. So again, this hand will never leave the needle. So here, all right, and 45 degrees up into the fat, removing this hand. I'm now going to pull back on my plunger, known as aspiration. We aspirate to make sure that we did not hit a blood vessel because this is meant to go into the fat. If you ever aspirate and blood fills into your needle, you would immediately pull out, discard, redraw, and start the process again. Now I am going to push my meds into my patient. I'm going to come out at the same angle of insertion. I am going to engage my needle and get ready to drop that into sharps. I'm going to use my gauze. Didn't have a gauze. And I'm going to massage the area and then bandage, because this is an arm, we don't need a bandage, and bandage my patient. Now the next part of this is I need my patient to wait around, okay, for 15 to 20 minutes to make sure they don't have an adverse reaction to the medication I administer. So I turn back to my patient, Dr. Beards, can you please wait around for 15 to 20 minutes just to ensure that you don't have an adverse reaction to the medication administered. I would then allow my patient, I would leave the room, have my patient either sit inside of the room or, depending on the flow of the office, in the waiting area. After the time has exhausted and there is no reaction, the patient is free to go. Today, we did a subcutaneous injection. It was a 45-degree angle. The needle size was a 5/8, and the gauge that I used today was a 25 gauge. Now, the areas, okay, was either the abdomen, the thigh, or the fatty area of the back of the arm. The needle size was a 5/8. You can use a 5/8 or a 1/2 inch. A 5/8 is typically what you'll just use for sub-Q. Don't worry about the 1/2 inch, just the 5/8. You'll use a gauge that's from a 25 to 27 gauge, okay? You will also want to make sure you aspirate, and the purpose for subcutaneous injections is for medications that need to absorb systematically slower within our patient's system. All right, so that's what we've just done. So let's go over the first 4 rights. We had right patient, right drug, right dose, and right route. So now we're moving to the right time. Keep in mind, certain medications have to be delivered at a certain time. Times such as postprandial. That means after meals. So you want to make sure that you're delivering your medication at the right time. So right patient, right drug, right dose, right route, right time. Now, the last one is called the right documentation. Keep in mind, if it hasn't been written down, it never happened. And in a billing world, we cannot charge for it. So everything that you do must have supporting documentation. So what we're going to do now is write down what needs to be written down in a SOAP. This is an assessment, so it will be written in the assessment part of the SOAP. So we're going to write in the A, the date. We're going to write the time. We're going to write the medication we delivered. We're going to write the amount that we gave. We're going to write the route that we delivered it. We're going to write down the route or location, the location or site, whether it was right arm or left arm, okay? We're also going to write down the lot number, okay, and the expiration dates of the medication we gave. And finally, we're going to give our initials and credentials. Remember, when this is at a hospital in a medical record, you're going to be writing this in a EHR, electronic health record. Once you log into your EHR system, you are logging in as yourself. That's why it's very important never to give anyone your login information. Okay? So what we have is the date we gave. Today is 11/15. The time we gave it, we're going to say we gave it at 5 o'clock p.m. The medication is 9% sodium chloride. All right, the amount we gave is 0.5 cc's. The route was called Subq for subcutaneous. You can abbreviate it and put SUBQ. You can abbreviate it as SC. It can be abbreviated as SQ, or you can write subcut, SUBCUT. You're going to put the location, right arm. You're going to put the lot number and expiration date, which is located on the medication vial. At the end, your initials and credentials. Keep in mind, before initials and credentials, I left one thing off. I told you to check for reaction. Please make sure that you document your R. R equals 0 or none, and then initials and credentials. Okay, this is going to be very important because you told your patient to wait around for the 15 to 20 minutes to make sure they did not have an adverse reaction to the medication that was administered. After they waited, you're going to come back and write the reaction. Remember, this is an assessment and it's going to be written in the A. Every time you do something, proper documentation needs to be applied to the chart. If you do not document it, it didn't happen. Therefore, we cannot bill for a service that is not documented, even if you did the service. So keep in mind, one more time, there are 10 rights to the medication administration, but the first 6 rights are in relationship to actually administering the drug. Let's go back to it. You will have a test over the rights of medication administration. You must be able to understand each right and what it entails. Right patient. What did we say? Make sure you verify by asking the patient their name, never telling. All right? Right medication or right drug. You want to do 3 validation checks to make sure you have the right drug. Also, the right dose. You want to check 3 times to make sure the right drug and the right dose, okay? You want the right delivery method, which is the right route, whether it's sub-Q, IM, ID, intramuscular gluteal, intramuscular deltoid. Then you want to make sure it's the right time that you're supposed to deliver the medication. And lastly, you want to make sure the right documentation, which is your date, your time, your medication, your amount, your route, your site location, lot number, expiration date, your reaction or patient's reaction to the drug. If there wasn't a reaction, R equals none or R equals 0, and then your initials or credentials, or in an EHR system, just an enter. And that is going to do that for you. Other than that, thank you for today's lesson on the subcutaneous injection. Tuesday in class, you are going to have to draw your medication. It's Monday? Mm-hmm. Oh, tomorrow, I'm sorry. Monday, you will have to draw your medication. All right? You're going to have to wipe off your vials. You're going to have to use the right needles to draw your medication. And you're going to have to make sure you understand by verifying that you have the right patient. Then you must deliver at the right area and the right route. Remember, the gauge is a relationship to the actual thickness of the drug. The viscosity of the medication determines the gauge. Well, thank you, and I look forward to seeing your videos tomorrow on your subcutaneous injection. This will be your first skill checkoff. I will also be sending you some handouts to do for tomorrow. Have a great day.